Hi, everyone. So talking a little bit about magnesium, it is one of the top micronutrient deficiencies in the United States. So that's something to think about there. And how does that play into your overall health? About 50 to 60% of magnesium in the body is found in our bones. And then the other half is kind of found in our soft tissues, such as our muscles. And then we have a small percentage in the blood as well. And you may have heard that magnesium is important for over 300 enzymatic reactions in the body. It helps regulate your glucose levels, your blood pressure. It helps to produce energy. Helps support detoxification, and it plays a role in transporting calcium and potassium into our cells. So I want to specifically talk about heart, nerves, mitochondria today, because there's so many things we can discuss with magnesium, but our heart's a muscle too. So not only is magnesium needed for skeletal muscles, but also our cardiac muscles as well. And deficiencies can lead to high blood pressure. It can lead to heart disease, arrhythmias such as AFib as well. So magnesium is really important there. It's also important for your nerve conduction. So magnesium kind of transports that potassium and calcium into our cell membranes, and the deficiencies can cause numbness or tingling in our extremities. So sometimes that gets misdiagnosed as a neuropathy when it's actually a deficiency. And then our mitochondria, which is our powerhouse of our cells, that's what produces energy. So it also stores magnesium and uses it to create additional energy sources called ATP. And so when we're deficient in magnesium, especially in the cells, we don't produce enough energy, and the side effect to that is what? Fatigue, right? How many of us have fatigue? It's known to be one of the #1 deficiencies that we see. So we absorb it in our small intestines here, right? And our blood is controlled by the elimination of our kidneys. So that's how we eliminate it. And when you have deficiencies like from magnesium, it can be from malabsorption, it can be from drinking alcohol, it can be the parathyroid, it can also be like renal disorders that are wasting, diabetes, your diuretics, digoxin. So some of those medications that we see. Some other things that can be caused by deficiencies of magnesium that I wanted to hit would also be that numbness and tingling. So those extremity numbness and tingling, really impactful to know your magnesium status. Although sometimes drawing a serum magnesium isn't the end-all be-all to know if you have a magnesium deficiency. So for Kim, hers showed blatantly low, but many people have deficiency and it doesn't show low. Another way to look at that is when you get a comprehensive metabolic panel. When you look at the alkaline phosphate, it's known that anything under 60 in an alkaline phosphate could be a deficiency in zinc and magnesium. So it's kind of like a backwards way of looking at that lab and getting that information as well. And then glucose and diabetes is hugely impacted by magnesium as well.
It's amazing that doctors don't make a bigger production out of it. I remember when I was low in magnesium, it was in my blood work, but when I went to the consult to follow up on my blood work, it was not mentioned at all. It was, hey, you're doing great. Good job, and we'll see you in a year. I went home, I looked at my blood work actually myself, and I thought, well, what the heck? I'm really low in magnesium, and it shows up with a big red flag. And yet the doctor said absolutely nothing. And I don't understand why. Is it something that they don't teach in medical school? Do they not realize the importance of it and the impact that a low level of magnesium has on your body and the potential for disease?
I think really some of the times what we're thinking about is in this fast-paced environment of the medical world, we're looking at the most acute things that can cause heart disease. Something like looking at high levels of your glucose and looking at high levels of cholesterol. And then we really stop with the minerals and vitamin needs that people have. Most people in the medical field, it's said that they have about 4 hours training in nutrition. And so that falls into these nutrients and micronutrients as well. So what were some of the symptoms, Kim, you were having with the low
Fatigue,
magnesium?
fatigue.
Yeah.
And also my muscles and my joints felt like they were a little tight. And so I as soon as I up my magnesium, and even Joan here, who's in our live studio audience, was mentioning that she used a spray. I used a spray that was pure magnesium as well. But with me, with the spray, it was a little irritating. And so what I was suggested to me by my functional medicine practitioner was just spray it on about 20 minutes before you're going to go in the shower, let it absorb, and then go rinse it off, and that has worked for me. So it's just part of my regimen now, just to spray a little magnesium on my legs, and then I go in the shower. And the other one I do is an Epsom salt soak of my feet. And I'm just curious your thoughts on the transdermal versus taking it
So
orally.
somebody who has like severe gut dysbiosis or they're having trouble with absorption of things, a transdermal route of many medications and minerals and things can be really impactful. One thing I thought was great, you said you did the Epsom salt soaks on your feet. So our feet have the largest pores of our body and can pull in nutrients. That's why, I don't want to skip around with a lot of things, but grounding outdoors and walking on the ground to absorb the magnesium thing is really important. It's pretty powerful thing to do for your vascular is to do grounding. So
Just regular soil, or are you talking on the beach, or
your beaches, walking outside, as long as they're not treating the lawn with chemicals, you should be able to walk and absorb the nutrients. Um, they say, we weren't really meant to wear shoes all the time. So
our diabetics though have to be a little bit careful, especially if you have neuropathy. But other than
exactly.
that, just be careful of where you're walking and making sure there's nothing sharp.
Right, right. But how many of you have been to the beach and have walked barefoot on the beach and feel so much better?
Oh, it feels so good. You do. You feel replenished. You actually feel grounded.
Yes, yeah. So, and some of those symptoms you were talking about, low magnesium, definitely that fatigue, but it also can feel like muscle weakness or spasms, trouble sleeping at night, depression can be a result of low magnesium, constipation. So that's one thing. Arrhythmias and then high blood pressure. So you need those. And your food sources are those dark leafy greens, oatmeals, your buckwheat, so your grains, your chocolate in the form of dark chocolate's probably
Oh,
best.
I like you. You're my favorite person
Uh,
today. I'm going after that dark chocolate.
Exactly. And your nuts and seeds, and even like lima beans. But somebody age 19 to 50, if they're female, 300 to 320 milligrams, males, 400 to 420 milligrams, and then 51 and older for females, 320 milligrams. For a male, it's 420 milligrams.